Hey, by the way, this meeting is going to be recorded, everybody. So welcome, good afternoon. This is the Opioid Settlement Fund Community Meeting that we hold once a month. I'd like to take a moment to introduce panelists or let panelists introduce themselves actually, and then we'll get into housekeeping and kind of just go through our brief agenda. So this is Connie Burke, Associate Commissioner for the Division of Data Management, Research and Planning here at OASAS. I'm joined by, as I said, Debbie Davis, also from OASAS. Do you want to say hi, Debbie? I didn't mean to steal your thunder.
That's okay. Good afternoon, everybody. On this lovely Wednesday before it rains, at least before it rains here in Albany. I'm Deborah Davis. I'm the Associate Commissioner of the Division of Fiscal Administration at OASAS, and glad to be here with you all.
Thanks, Debbie. Chris, do you want to introduce yourself?
Good afternoon. I'm Chris Smith. I'm the Associate Commissioner for Adult Community Care with OMH.
And Joanne.
Hi, everyone. I'm Joanne Warren. I'm the Deputy Commissioner for the Office of Health Equity and Human Rights here at the New York State Department of Health.
And we also have Lucia Clark, who is our project manager, project director for the opioid settlement funds here at OASAS. And also joining is Denise Gagno, who was one of our project coordinators, assisting with getting these projects up and out the door. In terms of kind of just updates, just reminding folks, there was an advisory board meeting last week on the 15th. The next opioid settlement fund advisory board meeting will be on July 10th. So please keep your eyes on the OASAS Opioid Settlement Fund Advisory Board webpage for information about how to join that meeting and be able to view it live, as well as recordings from previous meetings are posted in that same location. Just in terms of other information available to folks, please know that you can go to the OASAS webpage, the Opioid Settlement Funding Initiatives webpage, to find information about these meetings, to include the recordings, the question and answers that we get during the meeting, as well as those that come in through the email box. And then we also have information on requests for funding announcements. So the RFAs are posted there. As part of our procurement process, of course, there's a Q&A opportunity associated with each RFA, and those questions and answers are posted in that location as well. Beyond the state dollars that are managed through the procurement, we also have information on the regional abatement. So those dollars that we are responsible for funneling directly to, in this case, LGUs, so directly to counties, as well as the 5 large cities and other litigating entities that received dollars directly through the settlement fund. So in terms of work underway, and actually, since I just mentioned the regional abatement, Debbie, did you want to speak to our progress on that?
Sure. So the regional shares that are going to the LGUs, there's 55 local government units. We've processed payments to 52 of the 55. And then for large cities that are named, 5 large cities that are named, which are Albany, Rochester, Buffalo, Syracuse, and Yonkers. Is it Yonkers or yes? Okay, thank you. So we've processed 4 out of the 5 large cities. And then there's named other litigating entities, which are cities, towns, villages. And there's 21 of those, and we've processed 4. And the processing of payments is related to handing in a planned use of funds form and then going through the payment process. So we've been really successful because of all of you who have provided us great plans. We're very excited to get this money out to you. So out of a total of $64 million that would be paid to these entities, we've processed 61.6 or nearly 62 million. So we are super close to getting all the money out the door. And thank you very much for providing us those plans.
So no small effort there in making those dollars available. And we are meeting with LGUs on a monthly basis to discuss the process and their planning process, to discuss our reporting process, and just to ensure that we're, working collaboratively and we've got all communication channels open in terms of managing that work and moving the dollars and the initiatives forward, and making sure too that, the counties are able to stay informed about our release of RFAs, use of dollars, so they can coordinate their spending at the local level. So happy to be part of that collaboration and to have so many dollars out the door. I think that's probably the best thing, Debbie, right? To be able to say it's out the door, they have it. So in terms of other information, so we did recently announce the awardees for the low threshold buprenorphine RFA. There were 15 providers who were awarded. And let's see, we had one provider in each of the 10 economic development zones. We had 3 additional New York City providers. And then because of the use of the 7 million, we were able to identify an additional 2 providers in the rest of state who would receive awards. So that was announced on May 8th. We do continue to work, and Chris, you can shake your head as I say this, continue to work on trying to get the Addiction Professional Scholarship Program all set and announced. We're working with 4 of the SUNY affiliated schools in order to get MOUs in place and to make scholarship opportunities available to folks that are affiliated with the OASAS system, the OMH system, as well as the DOH system. So that includes CASACs, certified prevention professionals, and also certified peers as part of that effort. We also have our outreach and engagement RFAs that are in process. We had one RFA that was targeting street outreach, and then a second outreach and engagement RFA that was specific to implementing the clinic model that is in keeping with the work that was done by our legacy Cody providers. So those applications are being scored right now. We're in process. So still in a blackout period, and therefore not going to say more about those, but stay tuned to hear about award announcements. We also recently released the Community Prevention Coalition's fentanyl, opioids, and prescription coalition RFA. So know that I think that was released last week, and those applications are due on June 16th. So for more information, please refer to the Opioid Settlement Funds Initiative page on the OASAS website. We are looking to release, we're working currently on 3 additional RFAs, one related to transportation, another related to the research dollars that are allotted through OSF and the 10 priority areas, and then also something, a prevention RFA. So stay tuned, those will be coming out hopefully within the next, well, you'll see them come out over the next couple of weeks. So Joanne, anything that you wanted to add to the update?
No, nothing specific. I think at the most recent OSFAP meeting, I was able to provide an update as far as our continued work as it relates to the Department of Health preparation of RFAs. And so you should be hearing from us on our updates fairly shortly.
Awesome. Chris, anything you wanted to add?
I attended my first opioid settlement fund advisory board meeting last week, and it was a real opportunity to get a better sense of what's going on with this initiative. There was a lot of community feedback, which was helpful. And just, I mean, the biggest reason we're here, OMH is here, is because of the very strong focus on integrated care, ensuring that both the substance use and mental health needs of New Yorkers are being addressed by all of these initiatives. So happy to support that. It's one of our major joint goals and one of my major career focuses for a number of years now. So happy to support it.
Thanks, Chris. I think we're getting more in sync here, and in terms of working on the RFAs and looking for those opportunities. And what's great too about the collaboration is there is so much happening in the state that we're able to leverage other opportunities to support this work as well. You know, speaking of the integration piece, so having said that, we did have a few questions come into the Opioid Settlement Fund mailbox yesterday. I do want to address those. The first one had to do with a staff bonus from the settlement funds. And the question was, how many times can an employee submit for settlement funds? Is it twice or for every quarter they worked? Given the geographic location of the person who submitted this, I'm reading this to refer to settlement dollars that are not under OASAS's purview. I believe that this was asked in reference to the dollars that were issued either to New York City or to Nassau and Suffolk County, as we do not have any initiatives that included staff bonuses under OSF. So that's as much as I can say to that question. Certainly if someone wants to, if the person wants to reach out to the mailbox again and provide some additional clarification, if we can assist in answering, we will. The second question, are HCBS and core providers eligible for any of these funds? And so as a reminder, you know, these are jointly managed efforts between OMH and OASAS. And specific to each RFA, you'll see there is a section in the RFA with regard to eligible applicants. So it really depends on the initiative and what we're trying to accomplish in terms of which providers are eligible to apply for the effort. So I ask that you refer to those, that section on each of the RFAs. And then the third question is the eligibility of this program available to not-for-profits and for-profits. And so the opioid settlement funds are treated as state dollars, and therefore for-profit entities are not eligible to receive any of this funding. So we are only able to issue awards to not-for-profits using these dollars. So having answered those questions, I'd like to invite folks, if you do have additional questions, to please use the chat function to submit your question. Denise had pointed out that in your in submitting your chat, if you indicate that you want everyone to see it, you can indicate that so we can see everyone's questions. Everybody can see all the questions, as opposed to just submitting it to the panelists. So welcome any questions. I do see that Lucia and Denise have both provided the address for the Opioid Settlement Fund Project Management mailbox. If you'd like to submit questions or concerns there, you can do that, as well as the Settlement Fund Initiatives webpage. So our first question, if you've received funds from the county through a regional abatement, can you also apply to a future RFA released by the state? Yes, absolutely. So again, refer to each RFA in terms of who are the eligible applicants, and you are free to apply. Receipt of the regional abatement dollars through your county does not hinder your ability to receive additional funding through the state. Question, will there be any initiatives that address workforce challenges? Thank you for the question. And it is always the question, right? We all are very aware of the challenges facing the workforce right now, and are looking for opportunities to try to support the workforce, as well as create opportunities to increase the number of folks who are members of our workforce. So as I'd mentioned briefly earlier, we do have an opportunity to provide scholarships to those who are interested in receiving their credential in the field. That is something that will be announced shortly. We do welcome other suggestions around workforce support. And I do believe that we will continue to address workforce in that we do have additional dollars that we have not yet programmed. Remember that there were 10 priority areas identified by the board and a percentage of funding allocated to each of those. And so as we work our way through releasing dollars, know that we still have additional opportunities to come. There's a question, will there be funding to support existing syringe exchange and related harm reduction programs? So I already see Joanne's ready to answer that one. I just want to comment that syringe exchange programs were eligible to apply under the low threshold buprenorphine opportunity, as well as our outreach and engagement opportunities and harm reduction programs, I believe, were eligible. So we've already provided some opportunities through RFAs that were released, and I'll ask Joanne to comment further.
Sure. So thanks for that. And as Connie pointed out, through our collaborative work, SSPs and other harm reduction providers have been eligible for funding that's already out in the community. As we continue to move forward in DOH with the allocation of our funding, yes, funding will also be allocated for the enhancement or the expansion of SSPs and the services that are provided within those areas. So thank you.
Great, thank you. There was a question in terms of who should we send the suggestions to with regard to workforce. Please submit those to the Opioid Settlement Fund Project Management mailbox. That email is included in the chat. Folks can always feel free to reach out directly to Debbie Davis or myself as well. Let's see. So Mary was making the point that we need to address ways to recruit and retain staff. And also said things like loan forgiveness for social workers is an example. So thank you for that suggestion. I know Debbie may have more insight into the ability to address the loan forgiveness. And I do know, and I think this is true for all the state agencies, that we are looking for opportunities, not necessarily through OSF, but we have other funding streams that we are trying to leverage to also support the workforce. Outreach and engagement seem to only be for SERPAs. Most of our peers have AIDS Institute peer certification. So thank you for that comment, Emma. It is that is true that we were looking within the outreach and engagement RFAs for certified peers. I do know that this is something that actually Joanne has brought up in terms of the certification. And I think that's a conversation that DOH and OASAS will have with regard to certification of peers. Did you want to say something else, Joanne, to that?
No, I was going to say hi to Emma and agreed. I think there needs to be further conversation recognizing that there are multiple areas of peer certification within the state. And so, it's a continued conversation so that we can look at opportunities to be more inclusive.
Mm-hmm. Next question, can you provide an update on progress in meeting the % of funding distributed thus far in accordance with the 10 priority areas? So that is a great question and not one I can answer off the top of my head. So I can, as I look at the 10 priority areas, I know I can tell you that we've made dollars available in the harm reduction, treatment, investments across the continuum, and the prevention category, I think. But we do post answers to these Q&As, these questions. They're not, we'll give you the A's to the Q's when we post the document online. So we can provide more information, more specific information to that question, Marcy. I know Debbie may be able to speak to it, but we definitely will answer in the Q&A. Other questions? It's the quiet before the storm where I am. The sky is getting.
There's
Oh.
sorry.
Yep. Regarding scholarship dollars and staff retention and engagement, could that include training agencies? I think so. The idea would be training agencies in, would that be, I mean, John, if you could elaborate, in terms of training them on evidence-based practices, or I'm not sure what kind of training you are thinking of. Certainly scholarships that, again, are something that we're pursuing. Again, in terms of staff retention and engagement, OASAS has made funding available to our providers through other funding streams to help support and retain workforce. So I do think that, we are looking at it. Not everything is addressed necessarily through the OSF dollars. Go ahead, Debbie.
I was just going to go back to the previous question, but also add in that, we do have the priority areas from the November report, the November 2022 report from the settlement board. They provided the 10 areas: harm reduction, treatment, investments across service and continuum, priority populations, housing, recovery, prevention, transportation, public awareness, and research. And then within those areas, they provided, over 200, sort of ideas, concepts, important things that to focus on within those categories. And so workforce was definitely part of that. And so, as you know, that under investments across service continuum, we have been talking about, making those scholarship fellowships available. And so there's going to be more talk if you, watch the presentations and discussions at the board meetings. This is a hot topic, but also to Connie's point, we made $20 million available under a stabilization grant, and another 20 million under a workforce workforce grant under our supplemental funds for SAPT block grant. And then we made another 20 million available for stabilization, which was all part of trying to stabilize the workforce, for in the OASAS substance use field. So we are trying to bolster not only what is being done in the settlement funds, but bolster across many of our funding streams. So we know that there's more to be done, and that's why we really appreciate your ideas and the discussions that we have all across our service network. So thank you, and keep the ideas coming, but we are trying to get money out to you. And then related to the other question, just to share with you, so the funding that was made available under each priority was determined also by the board. So the percentages of how the money would flow. So there's 26.8 million under harm reduction. And about 15 of it is with UH, and Joanne had said they are working on those procurements. The other remaining amount was with OASAS and OMH working together. And so we've gotten, out of $11.7 million, we've gotten 9 million out the door. Under treatment, there was 14 million, and we've awarded so far about 6 million. So under investments across service continuum, DOH has about 6 million that they're working on those procurements, and we had about 13, and we've awarded, we're in the process with those RFAs. There's 5.2 million out to be awarded. So we're reviewing those, and we've already awarded about 200,000. And then under priority populations, DOH is working on procurements for 6 million, and we have are working on procurements that have been solicitations released but not awarded yet, which would award up to about 7 million. So those are the categories that are being worked on and have awarded money out the door already, in addition to the 61 million that we already put out for the regional abatements. And then under prevention, we have about 5.6 million that was released during Prevention Week for potentials to be awarded as well. So, a lot of money is beginning to flow.
Thanks, Debbie. That is helpful.
I sent Debbie, this came to me privately, Debbie, but in case you didn't realize, I was forwarding you the question. But if a city is receiving OASAS funds and that is contracting with an agency and that agency is ready to start providing services, but as a county, we need to follow our procurement process, which can take some time, can OASAS send a letter stating that they are allowed, meaning the city, to allow the LGU to procure at its discretion? So I think these are like getting into regional abatement procurement questions.
I couldn't follow the question.
Okay.
I think it'd be better to send that and we'll provide a written answer, but I will give a general answer. And we work with the LGUs all the time, right? So the most clear answer is that we are providing money to the LGUs, right? And those LGUs have to follow their procurement. We don't get involved with the procurement. If money is being provided to a large city, that is money directed to, if they're one of the 5 large cities, they too have their own funding and they too have their own procurement process, and they will follow that procurement process. And it's the same with the other litigating entities that are the named cities, villages. They are receiving their own money, although the LGU is helping us out with getting that money to them, but that they will follow their procurement process.
Mm-hmm. Mm-hmm.
But they can, please send me the question and we can take a look at that question. But in general, we've been providing guidance to say you need to follow your own procurement process, which actually, to answer another question, those entities may have rules that allow them to award funding to for-profit entities, which would be different from the state not being able to. So just share that too.
Mm-hmm. Thanks, Debbie. Helpful. There is a question about restating the categories, please, were there 4 or 5? So I'm not sure, Shannon, if you're asking about the ones within which we've gotten dollars out the door. There are 10 priority areas altogether, and that includes harm reduction, treatment, investments across the service continuum, priority populations, housing, recovery, prevention, transportation, public awareness, and research. So of the work that OASAS has done so far, we have made dollars available under harm reduction, treatment, I think investments across the service continuum, Debbie, priority POPs. Is that true?
Yep, and prevention.
And prevention. Okay, great. Thank you. Thank you. So I hope that answered your question, Shannon. I'll take it as a yes. I got a thanks there. Terrific. Other questions that folks have, other things that you want to ask about with regard to OSF and our efforts?
Oh, Connie,
Yep,
sorry. I had read the question as is wondering what she said restate. I didn't know if she was wondering what the ones were past the ones we've mentioned, the ones we have not RFA'd for yet.
So, yep, and I included those: housing, recovery, transportation, public awareness, and research. We are currently working on a prevention RFA as well as a transportation and a research related RFA. We've got a lot in the works. We're trying. In terms of, I got a question came in about putting information on the Opioid Settlement Fund Advisory Board webpage. So certainly, I think that was with regard to the 10 priority areas. Not sure. Debbie, if you can clarify that, that would be great.
And you mean Debbie who asked the question?
Debbie, and it came from
me, Debbie? Okay.
It came from a Deb, and it's to a Debbie.
We will definitely get something to the board and make sure that it's what you wanted, and we'll put it out on the website. That's absolutely a great idea, because this is what this forum is for, sharing all the information, and I think that's a great update to put out there. So thank you for the suggestion.
Yeah, and given that the board doesn't, is not meeting monthly, so, and there are updates every month, certainly. We're continuing to get things out, so we can do that. For the remaining funds to be spent under the categories, will the advisory board conduct check-ins with regional providers to get additional feedback from the community? That is a question for the advisory board. I can't answer that question. I encourage you to pose that to the board. Again, the next opioid settlement fund advisory board meeting is July 10th. And there is a public comment period. So I would encourage you to ask that question of the board. Other questions? I realize that it hopefully it doesn't feel too stilted. I know in trying to kind of manage the flow of questions and to answer things as they come in, asking folks to use the chat. It feels a little awkward, but I appreciate everybody's patience with that. There's a question, what type of research is OASAS seeking from those of us on the ground? I can't answer questions with regard to the RFA specifically, and I don't have, Felicia, I don't have an answer to that exactly. I think that through the establishment, of a research entity using the opioid settlement funds, I think that there will be more to come in terms of what are the questions we're trying to answer on the ground, what is the research work that we would like to pursue. So more to come on that one. Other questions? It's 1:34, so we certainly have time if folks have other questions that they'd like to ask. Lucia, are you getting anything in your private chat?
I could take this opportunity just to talk about the lovely topic of procurements, because I know everyone loves that topic. But I could just share, that part of the work that all the panel here is, working on within their agencies and collectively together as we collaborate is, we're trying to develop what's called a solicitation. A procurement vehicle is like an RFA or an RFP, or which stands for RFA as request for application, or a request for proposal, or a request for information. So, the language within the appropriation that supports the opioid settlement fund allows for us to have a lot of different types of solicitations that we can use to try to gather information from you all on, what we would need to see if you're eligible for this particular initiative or project, right? And then it goes through scoring, and then, the awards are announced, but that's not the final. Then we go into the contract. All the materials are really, really heavily state driven, meaning we have a lot of attachments and things that the AG's office, the Attorney General's office, and the Office of the State Comptroller require, because they are actually going to review the contracts before we can execute them. So that takes another little bit of a time frame, and so once we finish giving an award and then we get all those materials worked out and all of your signatures, we forward them on to the AG and OSC for their approvals, and then we're able to execute and actually get the dollars out the door. And so, it is just a little bit of a process to get to that final contract. So in case some of you are there and you're like, oh, I did receive an award and I have had communication from OASAS and I know I signed, we're now probably waiting for AG and OSC approval. So it is moving though, which is lovely. But just wanted to just share with you that wonderful, exciting process.
Only a fiscal person would think it's exciting. Just saying. But I appreciate your enthusiasm, Debbie.
I'm trying.
There is a question, can you provide an update about the round $2 for Suffolk County? And unfortunately, no, we cannot provide an update because for both New York City and Suffolk and Nassau counties, they had settlements separate from the state settlement, and OASAS is not involved in the release of those dollars. So you would have to defer to your county executive. I'm not even sure, actually, Debbie, who would be doing that, or perhaps your
Yeah, I think each of the counties have an opioid either task force or opioid settlement. I think if you go to the county page and look for that, you'll be able to see who's the main contact, and then, or maybe they have like a, oh, someone's saying it is the county exec's office. So yeah. And then they probably even have a mailbox to send questions to, but they receive their funds through a third-party distributor based on what the Attorney General had worked out in that settlement agreement. So that those monies flow, as Connie said, not through the state, not through our fund.
There was a question about how much will be allocated for research. In response to that, I can say of the 2023 appropriations, there was $918,000 allocated to the research area. Of course, this is for the 2023 appropriations, which in fact represent 2 years of appropriations. Two, the board recommendations for the percentages assigned to each of the priority areas were determined to hold for a two-year period. So those same percentages will be applied to the 2024 appropriations when they're made available.
And I can tell you what that is also, Connie. For the enacted budget, research gets $1,253,000.
Thanks, Debbie. Does COD fall under treatment? I don't know what COD means or stands for. Chris and Joanne, feel free to help me out on that one. Oh, co-occurring disorders. Thank you. Sorry, I should have known that. So in terms of treatment of co-occurring disorders, I guess that would fall under treatment.
But I would also say, right, all the
Not limited.
Yeah.
What, Chris?
Good, Debbie. I was just.
Oh, okay.
Yeah, I was just going to say, maybe I'm misunderstanding the question, but I mean, I think all of the procurements are with the lens, right, of, everything is being put out there with the idea that we are working towards collaborative integration of co-occurring disorders and SUD services. So when you look at an RFA, you'll see that there's sections that are looking to score the applications related to the entity who's applying's ability to speak to how they are going to address that. So that lens is applied across the board, but maybe, I don't know. Obviously, Chris, I defer to you.
Mm-hmm.
No, I think that's just right. I mean, I think we're also looking to continue to advance that, and Connie and I were just discussing with the upcoming prevention RFP to ensure that there's specific ways to make sure that the co-occurring disorders are incorporated. So it's really across the board. I mean, I think you'll see in the RFP so far, some of them it's more of a focus than others, but it's certainly being considered across the board. And I think suggestions on if we're missing anything or how we can continue to do better by that emphasis would be welcome.
Mm-hmm. Yeah, and two, just as a reminder, so we do include in all of our RFAs that OASAS is issuing. There is scoring around integration, being able to address co-occurring disorders. And then also their scoring related to equity, diversity and equity. So those are lenses that are applied to all of our procurement opportunities at this point at OASAS. Just a couple of comments. Beth commented that is awesome. Thank you. I'm not sure what exactly that is referring to, but I'll take it regardless.
It's referring to my procurement discussion.
Oh, yeah. That's wishful thinking. But Beth, prove me wrong. Tell me that it really was about the procurement process that you were thinking, how awesome is that? And it's probably the first time. Yeah, thank you, Beth. Focus on co-occurring disorder lens. Sorry, Debbie.
Thanks, Beth.
But no, it is appropriate, and it is great that it is, applied across the board. And certainly something that, our commissioner is committed to, as well as Dr. Sullivan. And for all OASAS RFAs, we are including that scoring, regardless of the funding source, for any given RFA. Oh, sorry. Beth is saying that she does find procurement fascinating, Deb, just so you know.
I know.
All right. Other questions or comments that folks have? I don't know if any of our panelists have. So there is a question that came in terms of getting a list of the links that that procurements will be released on. So those procurements are posted to the Opioid Settlement Fund initiatives page on the OASAS webpage, as well as under our standard procurement section on our webpage. So if you go to oasas.ny.gov, you can actually scroll through that first page of our site, and you'll be able to see the initiatives. I know Kelsey says that we lost you. I'm not sure, Kelsey, if you lost the meeting or if you lost where to find it. But our team is posting in the chat the links and the sites for getting information. Let's see, everyone. Is the county responsible to be part of the outcome data collection process that the cities submit? So that's a really good question. It's actually ultimately OASAS is responsible for reporting out on the use of those dollars, and this is in reference to regional abatement dollars. And we are working with counties in collecting that information. And so in terms of the 5 large cities, we'll be working with them directly to collect information. And then in terms of the other litigating entities, that's likely that would be coordinated through the LGUs in terms of receiving information. So we did just have a conversation with those who were in receipt of regional abatement dollars last week. Like I said, we do meet with folks monthly. So that is a process that we're working through, and there'll be additional info forthcoming in the next couple of weeks, given that reporting is due to us, according to the schedule, due to us, or by statute, it's due by August 1st. Thanks for the reminder, Lucia, that those regional abatement calls are the 3rd Friday of every month. And we do send out information to remind folks about those meetings at 1 p.m. no less. 2 p.m. Wait, which is it, Lucia? 1 or 2? 2. Okay, at 2 p.m. every 3rd Friday, our regional abatement calls. Other questions that folks have? Other fascinating fiscal information that Debbie would like to impart on us? I'm not saying please no, I'm leaving it open. See, I'm being receptive to it, Debbie. Other questions? Oh, nice. Ken Small says procurement rocks. All right, Debbie, you got
Way to go, Ken. I'll pay you later.
All right. Any other comments or questions from our panelists? Any other questions from all of our attendees? I want to thank everybody for joining us and can give you back a few minutes of your day if we have no other questions. All right, as a reminder, we do this once a month, so please join us next month. We will be posting answers to your questions on the OSF Initiatives webpage, along with the recording from this meeting. And don't forget, the next Opioid Settlement Fund Advisory Board meeting is coming up on July 10th. Have a great holiday weekend coming up, folks. Take care. Bye-bye.
Bye.